Greetings, friends and followers. This is Nurses Talking, and I am Del Barzi. And as always, if you like what you see and hear, subscribe, leave us a comment, and let us know what you think. So, here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing career, from students to retirees and everywhere in between. And so today, I'm very, very pleased to welcome Ms. Heidi Martell. Heidi is a nurse, a coach, an entrepreneur, an educator, a holistic nurse, she says, and a cannabis nurse consultant. Welcome, 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 Heidi.
Thank you so much. My privilege.
Thank you so much for doing this. I really appreciate it. So, firstly, I always want to know why people are nurses. So, why are you a nurse?
The complicated answer to that one. I would say originally my first exposure to nursing was when I was in a car accident when I was 18 and needed some prolonged care due to spinal and kidney injuries. And I really had the experience of a variety of different nurses coming to help care for me. And I had this one nurse, her name was Rachel, and she was just like my nurse angel. I just remember I was in the hospital for several months, and there were a lot of challenges with a sense of privacy and sense of dignity that would happen. I was immobilized. I, needed help for many of my normal
Yeah.
facilities, and
Mhm.
I found it really difficult. Someone would knock at the door and I would say, please wait a moment, and people would just kind of come walking in.
Yeah.
And that was my first experience. And Rachel was very different. She sat and talked with me. She spent time. She provided hope. She helped me as I rehabilitated. And so I think that was my first real spark where I thought, my gosh, this one person was so meaningful in my life and healed me so much, not physically, but also just emotionally, spiritually. And she was so different from a lot of the other nurses providing care as well. And so I think that was my first inspiration. I also had a wonderful hospice nurse who was taking care of my grandmother, who I was extremely close to when she was on hospice with bone cancer. And again, I just was so amazed with the beauty and the compassion and the dedication that these nurses had with my beautiful grandma Irene.
Mhm.
Um, and the last kind of spark was when our daughter was diagnosed with hepatoblastoma. Luna was her name. And I just realized at some point I was probably going to need to take care of her. And I just felt it would be important for me to have the education and the background and the ability to be able to care for her. And of course, carry on to care for others in the ways that those prior nurses had inspired me. So it's a long journey over many years to get there.
That's really awesome. And it sounds to me like, I don't know. For me, sometimes the outside forces talk to me, and it sounds like they were talking to you. Like, this is where you need to
Absolutely.
go. So what did you do between the first encounter and actually becoming a nurse?
hmm So the accident that I was in actually happened the weekend before I was supposed to start college, my first year. And so that was a challenge in and of itself. And I was actually doing an advanced standing program. So I was looking to finish my degree in 3 years rather than 4.
Hmm.
So I did soldier on, and I had my father and other classmates bringing me work to the hospital and recording lectures, and I was able to stay in school and actually complete the degree. And my passion at that point was really literature, theory, and photography. And so I spent time studying English literature and literary theory. I minored in women's studies as well as photography. And from there, I went on to do my master's in photography at NYU in New York. I moved out there to do some work. And photography was really it was really a form of art therapy. So from the time I had been in the hospital, struggling with a lot of medical issues, surgeries, chronic pain. And photography was this tool for me to somehow express and almost transcend the physical pain and the challenges through my artwork. So I worked with my own body, oftentimes nude images, but kind of images of struggle and transcendence. And I felt it
Wow.
was important to use my own body rather than possibly objectifying someone else's. And I spent several years making my work and showing my art in some kind of entry level galleries, which was, a nice step up for me. But over time, I realized I was not making art for the critics or to sell it. I didn't want to create art based on what trends were happening at the time. I really knew that it was for me and that my
Yeah.
passion was in creating it. And so from there, I transitioned into a psychology program, a PhD psychology program. But I took a year break to go to India to continue pursuing my yoga studies.
Yeah.
And that was just an incredible, beautiful journey. I was able to study with some of the great teachers that I had been, learning from some of their students. I practiced a form of yoga that focused a lot on kind of meditation in motion, which for me was very fitting, just based on how my body was going to be able to move. I couldn't hold all these complicated postures and things, based on
Yeah.
my medical
Yeah.
history. And the meditative aspect of it was just so beautiful. And at that point, I realized it probably wasn't my passion to go back and finish my PhD in psychology. Um, I just, I was trying to tie all these passions together. The photography and the healing and, the psychology. I loved studying psychology as well, and just the beauty of the mind and the challenges.
Yeah.
And my life in India took me in a different direction. I met my husband there and ended up moving back to the States after about a year and a half. And at that point, it was time for me I became pregnant, had my children, was teaching yoga and meditation throughout. And then it was at that point, when Luna became sick, that I realized, okay, this is probably the next step where I'd like to go. So nursing seemed like the logical fit for all of my skills and passions.
Yeah.
You have to interact from such a true place and a centered place with your patients,
Yeah.
and to be able to serve in that way and be really attentive and all of it. So it just tied everything together in a way that felt like, okay, this is what I've been training for my whole life. So
Yeah, yeah, and as you tell it, I can see it. I can see the threads weaving together, and you use words like struggle. With your photography, I was about to ask you what was your focus, and you said it right away that you focused on this, showing the struggle, and it was just such a good thing. I see coming through the threads coming through and tying together. You talk about being from a true and centered place, which came from all of that. So I love it. I love it. I love it.
yeah, and one thing I didn't actually mention that maybe would tie it together a little bit more is the medical piece kind of came in, not just my own and my grandmother, but as I was taking a bunch of my psychology courses, I had to take some master's level courses before the PhD.
Hmm.
I did a couple of internships, and one of them was actually at the Albert Einstein College of Medicine.
Hmm.
And I worked on a yoga study with breast cancer patients. And that was the first kind of light bulb. Oh, I can take my yoga, and I can use this. And I saw the benefit that the women got, based on the study we were working on. And I
Yeah,
also then was working at Sloan Kettering in New York, on art therapy intervention with pediatric bone marrow transplant patients. And that was another way where I said, oh, my art, not just the yoga, but I can bring this in, and how
yeah.
healing it was for the
Hmm.
kiddos.
Hmm.
So I think that provided me the bridge to say, oh, okay, now I know I can tie these all together.
That's really awesome. And so, as when you became a nurse, what areas did you work?
So I immediately knew I wanted to work in oncology, and that obviously was due to my grandmother, Luna, the two
Yeah.
most beautiful spirits in my life. And so I started a program since I already had my master's in another field. I went to the master's entry program in nursing at UCSF, and that was a way to accelerate my studies and be able to focus on oncology in particular. And so I really never had a very broad kind of medical, surgical, clinical experience because I was
Right.
allowed to directly specialize. And so I
Mm-hmm.
worked with adult and pediatric stem cell transplant patients. And the nurses were just phenomenal. The care they gave, they had appropriate nurse to patient ratios. So two patients, maybe three at max. And they were just amazing, not just so smart, but so dedicated and so compassionate. And I mean, I was a student, and just the way that they had to make sure I could do everything right to care for their patient, properly. And over time, they trusted me. And I just thought, oh, I knew that was the right choice for me. And so
Yeah.
my whole experience really was around, caring for patients who were, challenged with various oncological diagnoses.
Yeah. 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 I love it when I hear stories like that. So you encountered um many different kinds of nurses. Your first encounter with nurses was that some of them were a little not as compassionate as they could be. And Rachel stood out.
Yeah.
And as you went along, and here you're encountering nurses, talking about pediatric oncology, who to you are just the epitome of what it means to be dedicated. But so what does this mean then? As you see all these different kinds of nurses, is there anything about nursing life per se that you think you'd like to see change?
I think the biggest challenges right now are the staffing ratios are so unsafe, and it leads to mistakes, you know,
Yeah,
challenges, mistakes that
it
can
will.
actually cost a person's life,
Yeah.
mistakes that a nurse we might have to walk around with because we had six patients and we couldn't possibly get to everyone at every moment.
Hmm.
And so
Hmm.
you see the patient suffering, you see the nurses suffering, and eventually that leads to a lack of compassion, or that compassion fatigue that we talk about,
Yeah,
because we have our own struggles as individuals and humans.
indeed.
And we still give everything we have when we go on the job. It's not just a job, it is,
Yeah.
people's lives and well-being. And I really feel that in order to, there are so many areas we can nurse in. So not just the hospital, but the hospital is where we start, we get our experience. And I really think that that's where things need to change, because the trend right now that I see is hospitals hiring new grads out of school. They have a 2-year contract. They don't have a lot of, experience. They're getting that
Yeah.
experience. And then after those 2 years, they aren't going to raise salaries, they aren't going to change the staffing ratios, and so they bring in another set of new grads. You
Mhm.
lose all of your experienced nurses in that way through not paying adequately, not providing adequate ratios. And so we move into other fields of nursing, which I think are beautiful. And I think we need to focus much more on prevention, health and wellness, rather than disease management and
Yeah.
polypharmacy. And that will
Hmm.
keep more people out of the hospital, and that
Exactly.
may bring down some of those ratios as well.
Hmm.
So
Hmm.
that was the thing that really stood out to me most.
Yeah, 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 yeah. I I worry about this because it's clear that the decisions that affect nurses and affect patients are business decisions rather than healthcare decisions.
Yes.
And that, impacts lives. It impacts the trajectory of someone's life. It impacts a whole family, a whole community, so I don't know how we're going to fix this, but it needs to be fixed, because at the end of the day, the country, the society is really only as healthy as its sickest person.
Absolutely.
Yeah.
And that's where I think nurse coaching, came in to my life as a kind of, again, another light bulb where, you know, working with patients and clients from health and wellness perspective, which doesn't necessarily mean cure, but it does mean healing.
Mhm. Mhm.
It's a grassroots community nursing that can really start working around the world in a way that we can educate and support interventions and modifications, but not just with throwing pharmaceuticals, or not just teaching top down in 20 minutes and, see you later, come back in 6 months. And I really believe that having more compassionate nurse coaches and consultants available to their communities locally, and then of course online globally, there's a way that we can start integrative, holistic nursing and medical care that looks at the spirit, the culture, the environment, not the diet, all of it, not just the physical body. And I feel like that's the way that we can get people healthier, happier, and not on all the medications, and not necessarily having all the challenges managing chronic
Right.
diseases.
Yeah.
The question of, a doctor says, to a diabetes patient, you need to do X, Y, and Z. Well, did anyone talk to them about, do you understand what this means? What does it mean to you and your culture to have this or
Yes.
these symptoms? Do you have access to the kind of foods I'm telling you you need to eat? Do you have the funds to get your medicine? And
Exactly.
that's where, nurses, that's where we come in. We have a huge role. And as a coach, it's a perfect fit, to help people reach those goals and also explain, the medical side of things. So that is where I want to grow the field. I really believe that that is a good future for nursing.
Yeah, yes, yes, yes. And I like that because that in itself pushes back actually against, because we nowadays it seems to me anyway that a lot of medicine is governed by, and maybe governed isn't the correct word, but it's governed by algorithms. If this, then that. And what you just described pushes back a little bit against that kind of thinking, which is great.
Yeah,
So,
I mean, we're all unique. And if we're
mhm,
related to in that way, I really believe that those interactions with the medical personnel, whoever they might be, that can be extremely healing. My best diagnoses came from a doctor who sat and listened to my story,
yes,
not the
yes,
surgeons who actually worked on me, who should have known, when I had some complications. They said, we don't know, maybe it's just, side
yeah.
effect or something. But it was actually just a beautiful human being who sat and listened, and because they listened, they understood where the issue was, and they were able to then help. And that is, what we're lacking, because we don't even give our medical personnel the time to spend with their clients and patients to even listen to that
To even
story.
do that. Yeah, I know, I know, I know. So we don't give the time, and we're not educating in the way that that encourages that either. So, oh dear. So
I don't mean to be
this
negative, because I do
no,
see
no,
that
no, 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 because you
growing
know
this
what?
field will be positive.
It is positive, but that is the reactivation. And until we own it and recognize it, we're not going to do anything about it. And so what will happen if we don't do anything about it is that we'll all continue to burn out, and we'll all continue to give less than optimum care. And the whole society will become sicker for it. And so it's not
Yeah, and
necessarily
nurse
negative
coaching for nurses is
for
also
nurses.
a field,
Yeah.
for the nurses for who are suffering the burnout and have all those challenges. That's another way that we can actually serve our colleagues. So
Yeah.
it really opens us up to so many avenues to be of
Yes.
service and to work with healing in all
Indeed, indeed
forms.
it does. Indeed it does. Indeed it does. And so you said you consider yourself a what led you to incorporate cannabis into your practice?
Yeah, good question. So it really was my experience in working in oncology. And, at one point we moved from California to Texas for a clinical trial for Luna. And I started working at a hospital there, an outpatient bone marrow transplant clinic. And a lot of my patients started asking me, what about, using medical cannabis through treatment for symptom management, or, how would I even access this, or what would it look like? And I was not allowed, I was getting all the emails from patients responding on behalf of, the doctors I was working with their feedback, of course. But I was not allowed to address medical cannabis in any way. And I became extremely frustrated with that, because I felt that, when someone is managing a cancer diagnosis and a whole slew of toxic symptoms, why
Yeah.
not
Yeah.
put every tool at their disposal? And so that was kind of my first moment where, I thought, this is just not right. And yet I didn't want to violate the policy of the hospital that I was working with, because that's their right as well.
Mhm. Mhm.
And it was when we actually made another move to Arizona, where we currently live, that it gave me the opportunity to rethink, do I want to continue in the oncology field where I can't share this information, or do I want to try and somehow grow my knowledge in that field? And it just happened that coincidentally at that time, one of our sons was diagnosed with a brain tumor. And I started researching that, and a lot of medical cannabis popped up in the research for brain tumors. And so that was kind of, like you said, the second thing that kind of pushed me in the way that
Yeah.
I was led to nursing. I was led to, cannabis, medical cannabis for cancer patients. And from there, I just started, looking out everywhere. How can I learn more about this? I, found the American Cannabis Nurses Association. I found some other groups that were creating certifications. Dr. Dustin Sulak has a beautiful training. Dr. Bonnie Goldstein works a lot, most with pediatric patients, and they were two of the big pioneers. And as I was searching, I happened to come across a company in California that was specific, working with pediatric oncology patients and cannabis. And I was like, oh, this has got to be the thing for me. So I reached out, and it was a mom whose daughter had been born with a brain tumor. The mom had started this company on behalf of her daughter, and then of course all pediatric patients. And I apologize, so her daughter wasn't diagnosed at birth, but about 8 months old.
Yeah.
And she was just such a fierce mama, battling for her daughter in every way possible. And she had created a nursing platform, and wanted nurses to be able to counsel and advise other families in similar situations. So I finished my training that was available. They set me up on the platform. It was like a dream, come true, not to have to work with families in that way, but to feel that I could be helpful in some way.
Yeah.
Um, Knowing what we'd already gone through with Luna and then our son. And I was there for about a year, and then a lot of the laws changed, and the company wasn't going to be comfortable keeping the nursing platform because we have, the federal
Yeah.
illegality. And Tracy said to me, can you somehow continue serving our clients? And I was like, I'm going to start my own business.
Okay.
So, I contacted a lawyer, worked with him, looked at the standards, the Arizona Board of Nursing rules, the American Cannabis Nurses, the national standards, and we kind of put everything together to see, could I create something that would be, still protect me to work as a nurse and my
Yeah.
license, but to serve. And we were able to set up my company. So we set up Calibri Canna Consulting, and I started just working with all of our clients that I had been with prior through Canna Kids, and then the business, grew from there, mostly through Tracy Ryan, who started Canna Kids, and her daughter Sophie. She sent me my initial clients. She supported me, just kind of gave me the scope and the space to grow the field. And from there, I realized my patients and my clients really needed more than just consultations, one off or once every 6 months. So when I consult, I'm educating about the endocannabinoid system, which endocannabinoids have been researched and might be most helpful for different conditions, diseases, or disorders. Talking about best practices, how you take it, what methods, there's a lot to cover. And most of that is educational. And, a lot of these families, and I work with adults as well, not just children. And I work with other disorders, not just cancer, but predominantly that's who I work with. It just became a situation where I could grow what I could offer by adding coaching, because these were people going through treatment, they needed support, or they were dealing with end of life. And how could I be there for them to, be healing in some form, whether or not that ended up in a cure or end of life. And so I went back to the Integrative Nurse Coach Academy in order to become certified as a holistic nurse and a nurse coach. So then I could talk with my clients and patients, not just about cannabis, but other plants that would be helpful.
Yeah.
And also, how can I support you on this journey? And so it just became this way that I could provide the type of wraparound care that I wanted to, for my patients and my clients in a way that I fully supported and believed in what I was sharing and teaching.
This is such an awesome story. I just love it. It's to me like you get nudged into so many places. I, and I think what warms me most about as I listen to you speak is that not that you're nudged into these places, but that you listened and followed, and you listened and followed, and I love that. So
Yeah, I
if
mean, you
someone
have
if
to center and listen to your intuition at some
yes.
point.
Yes. And a lot of us ignore it. Yeah, a lot of us ignore it because very often it pushes us out of our comfort zone. And so we're like, maybe not. You
Yeah,
know?
but that's the beauty. That's what I loved, though. And the reason I actually was drawn to nurse coaching initially is the initial foundational education is self-development, self-reflection, self-care. If we are not centered and in that good place, we can't then bring our everything that we can offer to our patients and our clients. And so I was like, I need this too. I need to focus on this. So it's like, not only was it another, passion to study and learn, but it also was giving me the license and the permission to focus on my health and well-being and my development in order to then be able to offer it, outward. So that was what was beautiful to me as well.
Well, I'm so happy that you mentioned self-care because that was actually going to be my next question to you, was going to be what does self-care mean to you? Because, it means so
Yeah.
many different things to so many different people. So what does it mean to you?
So for me, it really is taking the time to slow down and give myself a chance to hear. When I say, listen to intuition, I think for many
Hmm.
years I just functioned, go, 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 my kids
Hmm.
and illnesses and my job. And even though, I was practicing yoga and meditation, I also practice Pilates, which is also very helpful for my own, body, but also very centering and meditative. And so for me, it was taking the time to not kind of just race through my practice. So, it was okay, I got check meditation, check yoga, I was losing what it
Yeah,
originally offered to me.
yeah.
And so for me, it was taking the time to slow down during those practices, but also taking the time for my family to, be in nature. So continuing my photography, going out and hiking and being able to just photograph and breathe and be in that awe. Um, and that allowed me then to kind of come back and bring that back into my practices and then be able to, offer it outward. My bank account was drained. I wasn't putting enough
Yeah,
in.
yeah.
And it really, it was getting to a point where I felt, I just had no I didn't trust my intuition anymore. And it took that moment of like, okay, something needs to change.
Yeah.
And that's where I was able to slow down and then rededicate. And so for me, the self-care is really spending quality time, with my family, being silly and goofy, being out in nature, and, continuing the practices that sustain my, physical and emotional well-being. And for me, that is, a yogic and a meditative practice.
Indeed, 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 I did. And I love that you mentioned being out in nature, because for me, that's almost the biggest thing. I love being out in nature.
Yeah,
So
beautiful.
you have encountered so many nurses in so many different roles. And what I realized as I grew older is that I could recognize a nurse without ever being told that this person is a nurse. And I wanted to know then, how do people see, what do we actually recognize? So I started asking the question, what, if you could describe the most essential quality of a nurse in just one word, what would that word be?
Compassion.
Compassion. It comes up so much. Yes.
Yes. I mean, it was already, on the tip of my tongue as you were asking the question. That is the one word that comes to me over and over again.
And it comes up a lot. And I'm, as it comes up so much, it occurred to me that I'm glad I started asking the question. Just because it comes up so much, because it comes up and we think about us as being compassionate to the people we take care of. Very often we don't extend that same compassion to ourselves. And so one of the things that I like to say to nurses is, remember to have a little bit for you. Have a little bit for you.
Yeah. And it's a challenge. I just recently had a conversation about this with my oldest son, who just started college, and he wants to become a nurse. And so it gave me pause to really think about a lot of the questions even that you're asking me today when I was talking with him. And, I really felt he would be a good fit because he is a very thoughtful, sensitive, and compassionate being. And but what I did say to him and remind him was that you have to do everything you can to make sure that you also show yourself that compassion, because we can be so hard on ourselves. We want to be perfect. We never want to do anything but be the best for our patients and our clients. And sometimes, we're human. We will make mistakes. We will have challenges. And if we can't extend it to ourselves, we're not really in a position to best care for our patients as well. And, I was just reminding him of that. And I said, I lost my way with that for some time, and I don't want that for you. And so I just keep kind of bringing it to the forefront.
Yeah. And I, we have to be, I used to tell staff that we really, really, in this profession, have to be each other's keeper. You've got to recognize when your colleague is having a bad day, or your colleague, something is off, and you've got to not everyone is going to share what's happening, but if we are astute enough, and that's one of the things about our training and our education, is that you get to recognize quickly when something is not right. And so if you recognize that something is not right, perhaps you need to be the one to just stand in the gap today for that person. Because,
Exactly. And those were the most beautiful and helpful moments for me when I was, starting out working in the hospital. It was just needing someone to help me, change the sheets while a patient was in bed, and I couldn't do it by myself, or someone who knew that, I had spine surgery, and, I don't have enough necessarily strength to have a larger patient to help walk them, and I need some assistance. The people who would jump in because they would see you've got a lot going on, and I would do the same for them because I appreciated it so much. And I mean, those were the beautiful, beautiful beings who, despite how overrun they were, and I include myself in that as well when I could, just said, hey, I recognize myself in you. And that's really what compassion is. And I know these moments, and I know what I would need. And please let me give this to you, because look at how you're serving all these other patients.
Yeah. Exactly, exactly. Heidi, on that note, this has been such a beautiful and an inspiring conversation. I love it. Thank you so much for doing this. I truly appreciate it. I'm going to visit this one a couple of times.
Oh, well, I need to thank you because I am so grateful that you have decided to take your time and your passion and your knowledge and to reach out to nurses like myself and others and to share that with the world because there's so much that people don't necessarily know or see about us.
Yes.
And I'm so grateful that you have decided to take up this banner. And I'm so grateful that you reached out to me. It gives me a chance to reassess as well. And from the bottom of my heart, it's my privilege. Thank you.
Thank you.